If you're finding yourself taking too many bathroom breaks, there are a number of steps women can take to find the relief they're looking for. We have some tips for a healthy bladder. Take a look.
Caffeine, carbonation, chocolates, and citrics. And one of the other things that we see is cranberry. Everybody wants to use cranberry for the urinary tract.
Right.
Well, cranberry is extremely acid, and it irritates a patient
so the
with
woman is now
cystitis.
drinking cranberry juice thinking she may have a UTI, and it's just exacerbating the situation.
Because there's this misconception that, oh, cranberry is good for me. I have been using cranberry pills, and I'm getting worse, not better.
Imagínate. All right, so as we continue to discuss the important lifestyle modifications, the National Institutes of Health has some tips for a healthy bladder. Take a look.
There are many things that you can do to keep your bladder healthy. First of all, just going to the bathroom to urinate on a regular basis, at least every 2 to 3 hours during the day, is important, even if you don't really feel the urge to go. In addition, make sure you take time to relax so that you can adequately empty your bladder. For women, it's really important to sit down on the toilet seat. Hovering over the toilet does not allow your pelvic floor muscles to relax completely and can maintain urine in your bladder, which can then contribute to having to go back and go to the bathroom more frequently, or potentially contribute to getting a bladder infection because the bacteria has a chance to build up in the bladder. It's also important to avoid restricting your fluids in an attempt to minimize your bladder symptoms. When you restrict your fluids, you can get dehydrated. And older people, when they get dehydrated, are particularly prone to getting lightheaded when they go from sitting to standing or from lying to standing. And once you get lightheaded, then you oftentimes have to sit back down again. In that process, you're taking much more time to get to the bathroom than if you maintained a good state of hydration so that you didn't have to worry about getting lightheaded. In addition, when your fluids are restricted, you're much more prone to constipation.
Staying hydrated and preventing dehydration is important. However, a lot of patients come to us ingesting large quantities of fluid because they're under the assumption that drinking lots of water is important and healthy. It's actually not recommended to drink large quantities of fluid. You should really just drink when you're thirsty, and drinking water instead of coffee, tea, or soda is preferred. As far as overactive bladder, there are a lot of behavior modifications that patients can make that can help prevent urgency, frequency, and getting up at night or nocturia. Those include limiting your intake of bladder irritants like coffee, tea, soda, alcohol, anything caffeinated, anything carbonated, anything very spicy or acidic. Just by making some small changes to your diet, you can make a big difference in your urinary symptoms.
Great stuff there. Do want to remind our viewers, if you have a question for the doctor, 855-796-4475. Doctor, I thought of a couple things as we were watching that. My first question is, if you have interstitial cystitis once, are you more prevalent to get it in the future? And how does a period or menstrual cycle affect it?
The exacerbations of pain and urgency and frequency with interstitial cystitis are more frequent before your period. They could happen all over the month, but more frequent before your period. Increase in sexual activity can also bring it up. But most importantly, stress. I have a patient that before her final exams, she gets her IC exacerbations. The rest of the year, she's fine.
Really?
But only when she gets to final exams. I have patients that have had a significant loss. They have lost a parent, and they have an exacerbation.
It's like a trigger?
Yeah, it triggers it.
Okay. There are a number of self-care measures, by the way, someone could do to reduce the impact of the symptoms. Let's take a look at these. Wear loose clothing. Okay, that makes sense.
Yeah.
Reduce stress, obviously, which that example you just gave. Stop smoking. Well, that's for everything in life, I would think.
That will help you anyways. And exercise, you have to watch the exercises. You don't want to get into this kind of boot camp type of exercise. You want to do things that will increase endorphins. You want to do yoga. You want to do Tai Chi. You want to stretch. You want to do things that are more gentle to yourself than just go into a high impact activity.
What about genetics? I mean, does that play a role, that maybe your mom got this a lot, or your grandmother, or la tia? You know, does that kind of family tree trickle down?
We would love to see, and there has been studies about trying to check for a gene for interstitial cystitis. Many of the patients, or the great majority of the patients that have interstitial cystitis, the layer that lines the urine, is gone. In other words, urine is getting into the bladder and it's irritating because the irritants on urine. So that layer that protects the bladder from the urine is not there anymore. And that is one of the culprits of treatment. Heparin, which is an anticoagulant, is very similar to this molecule of the layer that lines the bladder. So what do we use for patients that have interstitial cystitis during exacerbations? We put heparin as an irrigation inside the bladder.
Interesting. And we're going to talk about treatments in just a couple minutes. Before I take a break, I'm just wondering, doctor, when a woman is finally diagnosed and you give that clinical diagnosis, as you said, and you explained it so eloquently, how much of a relief is it for them? I can only imagine when they finally know and that it can be treated and they can move on with their life, because it's got to be, like we said, unbearable, painful, hard quality of life, difficult to even sustain the day. There must be some sort of like,
There are two things that are of high impact. Number one, okay, I'm not going crazy.
Right.
I know what I have someone that knows what I have.
Good point.
That's number one. The second thing is we have a path to get better. There's an actual path that is evidence-based, that's based on scientific evidence, that will get me better.
To learn more about this condition and the treatments, visit us online. And remember, if you have a question, please reach out. You can send us an email by visiting our website, allhealthtv.com, or just give us a call, 855-796-4475.